Hey guys, this is Dr. James Kim from Detox Secrets. Today I'd like to talk about how you can crush your GERD fast. Have you ever experienced these symptoms before? Fierce object inside the throat and having sore throat. Experiencing shortness of breath and dizziness feels like getting punched in the stomach. Wake up in the middle of the night from the stomach ache. These are typical symptoms of gastroesophageal reflux disease, also known as GERD. When you're experiencing GERD, you feel you have no energy and no strength. Sometimes you feel like you are going through a hell of a time. The quality of life decreases dramatically. Let's find more about gastroesophageal reflux disease, which many people suffer from despite talking and having a lot of trouble. It is a disease in which food or acid in the stomach travels up the esophagus. In the human body, there are two sphincters between the esophagus and stomach, the upper esophagus and the lower esophagus. The function of these sphincters is to prevent the reflux of food or acid from the stomach. In a normal stomach, the sphincter of the esophagus normally opens when food is ingested. However, when gastric function is impaired for various reasons, gastric juice refluxes into esophagus. At this time, the symptoms of GERD occurs. How do you find out if you have GERD? The following are typical symptoms of GERD, and you can check yourself if you have any of the indicated symptoms below. First, burning pain in the chest and heartburn. It is a pain caused by irritation of reflux gastric acid due to damage to the esophagus and mucosa. Usually, when eating spicy food, you can literally feel a sensation of your mouth being hot or tingling. This feeling is similar to the pain in the esophagus or chest. Some people mistake this burning pain in the chest for a heart attack. If you have a chest pain, you could also experience the same symptoms when you have problems with your lungs, esophagus, skin, mucus, bones, and cartilage in your ribs rather than your heart. Additionally, gastritis and gallbladder problems and anxiety can also cause chest pain as well. Second, feeling of foreign body in the neck. It is a symptom that complains of discomfort as if a small foreign object is hanging in the throat. They say that the irritation or inflammation of the throat mucosa is dry and uncomfortable, so it looks like phlegm. The throat is a muscular passageway through which food is carried into the esophagus and air enters into the lungs. In some cases, the esophagus itself is damaged due to the reflux of stomach acid and feels you have a foreign body in the throat. Third, abdominal bloating. It is a symptom of feeling of bloating as if the stomach has swelled from overeating. This is a symptom of tension in the mucous membranes or of the esophagus and gastrointestinal tract. Fourth, voice change. Symptoms appear as if the voice is hoarse, even though there is no strain in the throat, such as screaming loudly. Many people consider the hoarseness of the voice to be a sore throat. If it is a sore throat from cold, it will heal naturally in about a week, even if you don't take any cold medicine. If the symptom persists even after a few weeks, GERD is suspected. Fifth, dry cough. The human body is built naturally to expel foreign substance through coughing. However, when you have a persistent dry cough, it can mean that there is not enough mucus produced to moisten the throat. Thus, foreign substance cannot pass down the throat easily. This could be caused by reflux acid from the stomach. 6. Bad breath. When you have bad breath, it can cause from the stomach acid and food reflux, which remain in the throat. Many people have the habit of lying down right after eating. It is recommended to refrain from this as it can easily cause reflux esophagitis. Let's talk about causes of GERD. Westernized diet, sedentary lifestyle, obesity, drinking, smoking, excessive stress are all thought to cause GERD. In particular, stress is something that we all cannot avoid these days. I also experience a relapse of esophagitis whenever I'm overly stressed. Acid reflux can occur when eating meat and fatty foods. When these foods are ingested, it takes a long time to break down in our digestive system. When it takes a long time to digest, abdominal pressure is elevated, which creates conditions that are prone to acid reflux. Some people are born with a sensitive stomach. Alternatively, people with decreased gastric function may experience upset stomach when taking nutritional supplements on an empty stomach. In some cases, you may experience getting punched on the stomach as well. Everyone is different as far as the absorption rate and tablet rate. However, I highly recommend you to take nutrition supplements made from organic ingredients that are close to nature as possible. People with impaired gastric function may experience less gastric acid access when taking nutritional supplements with meals. Avoid eating foods and drinks that can exacerbate GERD, especially beverages containing caffeine such as coffee, green tea, and black tea, as milk can stimulate gastric acid secretion. Therefore, avoid food and drinks that irritate the gastrointestinal tract as much as possible until the symptoms of reflux esophagitis subside. People who frequently eat flour-based foods are more prone to gastroesophageal reflux disease. Gluten in wheat flour can easily cause digestive disorders such as irritable bowel syndrome and esophagitis. The problem is that this gluten is the main cause of not only digestive disorders but also leaky gut syndrome, causing systemic inflammation and can lead to various diseases. GERD can occur with prolonged drug use and drug abuse. Thiopylline, albuterol, muscle relaxants, overactive bladder drugs, migraine and antidiarrheal drugs, antihistamines, and antidepressants can make reflux esophagitis worse. Medication habit can also be a problem. NSAIDs are non-steroidal. People taking these types of anti-inflammatory drugs should not lie down immediately after taking them. When you lay down within 30 minutes of taking NSAIDs, it can stick to the inside of stomach wall in the stomach and can cause a stomach ulcer. If you are a frequent user of NSAID, you may experience GERD. Long-term use of NSAIDs can irritate the stomach lining. Its associated symptoms may increase nausea, bloating, and abdominal pain. And the mechanism of this drug is to inhibit the synthesis of a substance called prostaglandins that protects mucous membranes. This means that the prostaglandins protects the gastrointestinal wall, but when the synthesis is decreased, the weaker the gastrointestinal wall becomes. This can lead to bleeding and perforation of the stomach wall. Additionally, the intestinal mucosa is also damaged. When the intestinal mucosa is damaged, leaky gut syndrome occurs. Leakage in the intestine leads to decreased immunity, so it is not good from a long-term perspective. So it is recommended to take it with consideration for the body as much as is possible. So let's talk about foods that can help with GERD. I would like to introduce cabbage, honey, ginger tea, and pineal salt as foods that are good for reflux esophagitis. Cabbage contains vitamin U. This ingredient protects the mucous membrane of the stomach and helps to activate the digestive function along with the metabolism of the gastrointestinal mucosa. Therefore, it is an excellent food choice for reflux esophagitis. It is also known for beauty, diet, blood circulation, constipation, and prevention of cancer. Honey. In the ancient Egypt, honey was beloved by King of Egypt and was found in an Egyptian tomb. Honey is known for its effectiveness in treating cardiovascular disease, cold hands and feet, skin purification, hangover relief, gastritis, reflux esophagitis, and Helicobacter pylori. For honey, I would recommend to use Manuka honey or pure honey. Ginger. Ginger has the effect of warming the stomach and is known to promote the function of the gastrointestinal tract. Also, it activates immune function, blood circulation, and makes the stomach muscles stronger. However, if you eat ginger as it is, people with sensitive stomach can experience stomach upset. Salt. Many people know accustomed to the fact that too much salt can be a problem. The problem is that salt on the market is refined salt, and they can cause many problems. In other words, refined salt can cause cardiovascular problems because it does not contain a large amount of minerals necessary for the body. I would argue that you should rather eat salt. However, it is highly recommended to consume salt rich in minerals rather than refined salt on the market. Salt rich in minerals actually strengthens the stomach and gastrointestinal tract. I would recommend to use Epsom salts. If you want to get rid of the symptoms of reflux esophagitis as soon as possible, you can make a hot tea out of honey, ginger tea, and Epsom salt and drink it regularly. In Oriental medicine, stomach is viewed as a warm and dry organ. Therefore, when you have GERD, it is better to eat warm and dry foods and drinks for your stomach. If you are suffering from gastroesophageal reflux disease, try a steam pack on your stomach by lying down for 30 minutes in the morning and evening. Within a few weeks, the symptoms for GERD will disappear. If you're tired all the time or burn out because of stress or you have GERD, then your body needs a detox. To help you start detox quickly and easily, I prepared a checklist so you can check whether your body needs a detox. Also, I have included a detox juice recipe below, which you can download for free. So if you like this video, please subscribe and like and share it. Thank you and see you guys next time.